World Spine Care, and to come and explain a bit more about World Spine Care and what it's all about, we've got Geoff, who's the director of World Spine Care. He's here to tell us all about that organization. Good morning, Geoff. How are you doing?
Morning, thanks.
All right.
Good.
Let's just start off by you, letting us know what World Spine Care is all about. Tell us about the whole initiative as well as the organization itself.
Sure. World Spine Care is a non-profit organization registered in Canada and the United States with the goal of bringing evidence-based, interprofessional, sustainable care for spinal disorders in underserved regions around the world. So by spinal disorders, I mean, we're talking about things like back pain, neck pain, headaches, congenital disorders, degenerative changes in the spine, scoliosis, things like that. What we don't deal with are spinal cord injuries. You have a great organization here in Botswana called Spinalis that's dealing with spinal cord injury, and we're sort of dealing with everything outside of spinal cord injury with respect to the spine. Mm-hmm. And if you look at global statistics, low back pain alone is the leading cause of disability worldwide. Spinal disorders or spinal pain, if you look at the global burden of disease and look at all the diseases contributing to global burden, spinal pain is more significant and contributes more to that global burden than HIV, diabetes, stroke, lung and breast cancer, Alzheimer's, a lot of these things that we think are major contributors to global burden. So mainly in the past 3 or 4 years, we found that this is really actually a global crisis. And World Spine Care is the only organization that's, or the first certainly, but really the only at this time, organization that's dealing with this on a global scale from an interprofessional, evidence-based, sort of sustainable way. There are other organizations that deal with short-term spinal interventions around the world, but none of them are trying to create a long-term presence. Mm-hmm. So when we initiated the organization, we were looking for a place where we could sort of develop our model of care and test it out. And Botswana was just the perfect place. And luckily, the Botswana Ministry of Health had the vision and the resources to be able to help us initiate that program. So we came here in 2011 and signed a memorandum of understanding with the Botswana Ministry of Health to make this sort of a collaborative effort. Mm-hmm. And over the past 2 years, we've really made huge strides in the development of our program. So we have 2 clinics. One of them is in the Mahalape District Hospital, and one of them is in Shoshone. We've treated close to 800 patients so far since we opened. We've initiated several programs. So one is the scoliosis screening program in the primary schools. And another program is a Straighten Up program, which is sort of a exercise program for the prevention of spinal disorders. And then we've done other capacity building initiatives. One of the big ones was we hosted the first spine care conference in Mahalape, where medical professionals from all around Botswana came and listened to presentations from world-leading experts in surgery, conservative care, and research on spinal disorders. And it was a very successful conference. And then I guess the most important one in terms of sustainability is we initiated a scholarship program where colleges from the United States and Canada and the UK offer free scholarships to students from our participating countries, which right now is Botswana, to go and train as spine care specialists and then come back and eventually take over our clinics. So the goal is to take our clinics and right now they're integrated into the regular healthcare system, but eventually not only will they be fully integrated into the current healthcare system, but they'll also be run by Botswana and not by foreigners. So it'll be a fully Botswana program, and we'll be able to sort of leave and maintain support and guidance, but not really be part of that system. So it'll be a Botswana system eventually, and that'll be about 5 years from now, because the first Botswana student, Hilda Malate, has just started at the Palmer College in Davenport, Iowa, and then Sheila Sebupelo will be starting in Canada in the fall. So within 5 years they'll both be trained and back in running the clinics.
All right. I'd also like us to go into the importance of the spine. I'm assuming that obviously for you to have come up with an organization such as this wanting to, to be availing that kind of assistance or help that you are and treatment that you are to the general public, then clearly the spine is a very important organ in the body, or part of the body. So why, the spine in particular?
Well, that's a big question. The spine, it is one of the major support structures. It allows a lot of movement, but at the same time protection. So just the way it's designed in the small vertebra, that each segment has a very small amount of movement. And so, but together it allows a large amount of movement. Those little bits of movement in each part of the spine allows a gross movement. So it allows our bodies to move quite a bit, but at the same time it's protecting the spinal cord, which carries all the information from our brain out to our body to control movement, but also brings all the information from our body back to the brain so that we can sense our environment. So it's an incredibly important protective organ, but at the same time allows this incredible range of motion. Because of there's so much motion, it also is a very vulnerable system to dysfunction. And that's why low back pain is a much more common type of pain than knee pain or ankle pain or any other joints in our body. The spine tends to be that organ that's very vulnerable. So it allows us this great freedom of motion. It allows us to do all the sports and activities and everything that we do, but at the same time there's this vulnerability. And also because the nerves actually exit through and between the vertebra, it's a point where there's a lot of vulnerability to irritation and damage of nerves and so on.
All right, so let's just go for a quick break, Geoff, and we'll talk more about the World Spine Care when we get back.
Okay.
And we continue our interview with the Director of World Spine Care, Geoff, who's here to just tell us about that organization which helps people with spinal disorders. Geoff, there's something that I'd like to understand, because generally what we do traditionally, I believe, is if you experience any kind of back pain, you get somebody to massage you, and even I know that's it's something that has been done from way back in our communities. You find that an older person gets a younger one to actually even step on that back to just kind of give them that relief. Is it safe to do that? Is it safe to get somebody who's not a professional to just massage me and just try to help relieve the pain?
Yeah, for the vast majority of cases, massage is just fine. That's absolutely okay, and those are some of the treatments that we do. We just do maybe a little more specific and a little deeper, but that's really part of some of the treatments that we do. Most cases of back pain are going to resolve within a certain amount of time. And some of the important things we tell people are, don't let the back pain stop you from doing what you can do. If you can continue being active, it's very important to be active. Don't let it sort of deter you from continuing on with life if you can. The worst thing you can do is actually rest. So it's great to stay active. But doing those sorts of things, keeping mobile, maintaining your movement, stretching, all those sorts of things are really good for the vast majority of back pain cases. There are some cases where the actual cause of the pain is a little more worrisome, but that's exceptionally rare.
All right. Now, I'd also like to know now, who at what point should I seek help, because like you're saying, the average kind of back pain can actually just be relieved from the kind of things that you've been sharing with us right there. But now, at what point should I actually come to World Spine Care?
If it becomes chronic or if it becomes recurrent. If it sticks around longer than a week or 2 weeks, then there's definitely something there. Even if it slowly goes away, there's a chance that it'll recur. So coming in if it's either recurrent or if it's chronic, or if the pain is getting worse, definitely. And basically you're coming if there's pain without a fever and pain that wasn't caused by a major traumatic injury.
Okay, and who should come to World Spine Care then?
Basically anybody who has pain without a fever and pain not having had a traumatic injury. And the pain doesn't have to be in the spine. It can be shoulders, hips, knees, ankles, any musculoskeletal pain we treat in the clinic.
All right. And what are you currently doing to make sure that you reach out, to the rest of the country? Because I understand, you as you've already mentioned, you've treated like around 800 patients and stuff, but would you like to just go into what it is that you're doing currently to try and make sure that you get your word out even further? Obviously,
I'm here this
over
morning.
and above this interview. Yeah.
Yeah. Well, there is another media conference, so there will be media going out. But up to this point, we haven't had to. We've been busy in the clinic without really any publicity whatsoever. Just local word of mouth has kept us very busy. So we haven't needed to do any sort of publicity.
Okay, and do I need a referral or anything of that sort for me to come towards spine care, or can I just self-diagnose and come through and explain whatever it is that I feel I've been experiencing?
Well, I wouldn't say self-diagnose, but if you have pain, yeah, you can just come straight to us. We are, all the doctors who work in the clinic are licensed to diagnose. We're primary contact, so you can come straight into the clinics without a referral.
And do I need to pay?
No, this is a volunteer organization, so we do not charge anything.
All right. Can you go back to now the where and when? Like, where can I see you? When can I come see you?
We are, right now, we have the Mahalapi District Hospital Clinic, and we're there Tuesdays and Thursdays from 8:30 in the morning till 2 o'clock. And then in Shishong, we're there Monday, Wednesday, Thursday from same times 8:30 until 2 o'clock.
All right. And could you please get your contact details?
Yeah, the phone numbers aren't off the top of my head. But in Shishong, the number is 476-9033. And at the Mahalapi District Hospital, the number is 471-2072. If you'd like to know more about our organization, our website is worldspinecare.org or worldspinecare.com, and you can get more information about our organization on there.
worldspinecare.org or worldspinecare.com.
That's right. And we also have a Facebook page.
Okay. Any chances of you having even more clinics across the country? You're obviously seeing the partnership that you have with the Ministry of Health.
Yeah, so going into the future, our ultimate goal is to expand this program to be a nationwide program. So it's just a regular part of your healthcare system. So even when the clinics are run locally, we'll still be helping to facilitate the expansion of those. So as more Botswana are trained as primary spine clinicians, that program can then expand across the country. So that's the ultimate goal. Now that may be 5-10 years before it's nationwide, maybe 15 years, because it just takes time to build a clinic, develop it. But now that we have the model of care developed, it'll be a lot easier to just sort of take that model and transport it to different hospitals around Botswana. It's just finding the people who are trained in primary spine care.
All right. Briefly, you spoke earlier about having actually sponsored or facilitated sponsorship for 2 students already to go and study for this. Just as a word of advice, who or what does one need for them to be able to become a specialist, for spine care?
As long as they have a university education, then they're eligible to apply. And we send out calls for applications, and then people apply, then we interview, and we're just looking for the best candidate out of that group. And so really it's just a university degree, and then they go and they train for either 4 years or 5 years, depending on the school that's accepted them in, and then at that time they then come back and they learn our particular model of care and then slowly take over the clinics. All
right. Well, Geoff, thank you so much for having joined us this morning, and keep up the great work. I believe it's you've touched a lot of lives, and it's great what your organization is doing, and we hope a lot more Botswana seek help and also develop interest in the area, so that we get to have even more people who specialize in the field.
Yeah, and actually in moving forward, we are, because we're a non-profit organization, we do need constant support. So we are hoping that some businesses or corporations within Botswana are interested in getting involved and helping support us to actually expand the program.
Definitely. Let's hope they'll get hold of you at www.worldspinecare.org or .com. Thank you so much for having joined us this morning.
Thanks.
Enjoy the rest of your day.
Thank you.